Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At BluZone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit BluZone.health and take the first step towards stronger lungs and a healthier future. BluZone Health. Breathe better, live better. Hey everybody, and welcome back to the Cozy Lung Lounge. We're here today with just me and Kelly, and we're going to be talking about hospice care, everything about oxygen and medication. So we're really excited for today, and Kelly's going to be leading us in this discussion, and we're excited to hear lots from you.
Hi, everybody, and welcome. Yes, Gina's at a conference. We all have to go to our conferences to keep our medical education top of mind. So we will miss her. She will be back next week. But yes, we're going to talk about hospice, palliative care, and all those good things. But I want to start, Amy, by saying if you are going to go on hospice or palliative care, either one of those, it doesn't mean we don't treat you. It doesn't mean we put you in a corner and forget about you. We are very much there for you, mostly trying to keep you comfortable more than anything else. And there's a lot more to it, of course. But I just wanted to put that up, number one, that it doesn't mean you don't get any more treatment.
So what is really the main goal in putting somebody on hospice care? What exactly does that mean for someone?
Whenever anybody asks about hospice, I always contrast that with palliative care because they're closely aligned, but they're actually two different things. So if someone decides to go in palliative care, that can include curative measures. So palliative care was actually, I believe, made more towards cancer patients who still want to get their chemo and still want to get their radiation, but they also want to be kept very, very comfortable. So they're still taking those curative treatments. Whereas if you're on hospice, we're not doing curative treatments anymore. And that means, yes, you still get your albuterol and your breathing treatments and things like that, but we're not doing any curative treatments. We're not doing any CPR. We're not calling 911. Or it doesn't mean you can't go to the emergency room. If you are on hospice and you really feel like you're short of breath and you feel like it's because you caught a bug and you want to try to just power on through this, yes, absolutely. But it just means no CPR. We're not going to do any heroics. And a lot of people, when they get onto hospice care, as soon as you enroll in hospice care, hospice also is paid for by Medicare and sometimes Medicaid, whereas palliative care is usually self-pay or paid for by insurance. And talking with your healthcare team will really help you decide which one will be the best for you. But if you go on hospice and you have COPD, for example, or ILD or asthma, you will likely be delivered a whole lot of albuterol, some oxygen tanks, some nasal cannulas, maybe even a pulse oximeter, depending on where you are. And there's a lot that goes to that. And I kind of, the oxygen is prescribed for your comfort, but the shortness of breath that comes with COPD isn't always caused by a lack of oxygen. And so one thing I like to recommend for people who are going on hospice, if they don't already have it, and they do for those shortness of breath episodes, is a fan. Just get, a medium-sized fan to circulate air in the room so that you feel like you're getting more air, because more oxygen isn't going to help you. If you're really, really desaturating, even then, probably that oxygen won't help you. But if you're sitting around saturating in the 80s, yes, go ahead and put it on. But that's not going to be the thing that will make you feel a whole lot better the way people think it will. So, and the same thing goes with albuterol. You can continue your albuterol treatments, keep your airways open, put that shortness of breath at bay. But if you start needing a whole lot more albuterol, that's not really going to be the thing that saves you. It's just to keep you comfortable.
Are people given oxygen even if they don't desaturate a whole lot?
Yeah, so for example, my mother ended up on hospice care for a variety of reasons. She did not have COPD, never a smoker, no lung disease whatsoever. But the minute she went on hospice, they sent her a giant box of albuterol, oxygen tanks, et cetera, and a hospice nurse that came in and checked on her all the time. And I said, she doesn't need this. She's never used it. Why now? Well, it helps with the shortness of breath. And that's something I really want to honestly address, because that shortness of breath as you get towards the end of life is natural. That's what happens. So the albuterol is there to help you if you're feeling more short of breath than usual. But if you're on hospice and you've never had any lung problems whatsoever, albuterol is probably not going to help you, and neither is the oxygen. Again, a fan will probably help you breathe easier because you'll feel like at least there's air circulating close by.
So they just give that to everybody who's been put on hospice care? That's interesting. I had never heard that before. Actually, I think we talked about it in a previous podcast, but that's not something I've ever really heard much about.
It's crazy because honestly, everybody thinks albuterol fixes everything. And yes, it will alleviate the shortness of breath, but not in the way that you think if you've never had lung disease. And so it's just kind of silly that they get all these things that they've never needed before in their life, and they sure don't need it now. So, but I noticed also there's questions that come up a lot about if you've been on oxygen, or if you're starting on oxygen at the hospice phase or palliative care phase, can you become dependent on oxygen? And the answer is no. The only way you become dependent on oxygen is if you cannot saturate your own blood with oxygen. Then yes, you will need oxygen, but using oxygen doesn't make you dependent on it.
And so that won't cause withdrawals or anything if somebody chooses to come off that oxygen?
Only if they need it. If they desaturate without oxygen, then yes, they're going to feel it. But if they started on oxygen and they decide, you know what, I don't like it, whatever, I don't like the cannula, I don't like this thing in my nose, you're not going to go through withdrawals. You're not going to become addicted.
All right, so switching gears over to some of those medications that patients get when they come into hospice, what are some of the most common medications?
Besides albuterol, they may get some opioids to help them, especially if they have pulmonary fibrosis. The opioid class of drugs will really help with the shortness of breath, and it somewhat helps for people with COPD as well. And if you're on hospice, I'm hoping you have somebody that's helping you and caring for you, that you're not on hospice all alone and trying to drive yourself to appointments and trying to do that. So if you're taking the opioids, please don't drive anywhere. Please, just be very careful. It's not a lot. It's a very small amount, but it's just enough to take that edge off of that breathlessness. And then some other medications, sometimes they might give you some anti-anxiety medications, maybe some Valium or some Xanax, something like that, just to take away that anxiety that happens with the shortness of breath. But if you feel like you're very, very anxious and short of breath and the fan's not working, the albuterol is not working, definitely you can ask for some anti-anxiety medications to help you. And then some other things they may give you, again, falling under the classification of not curative. So they may give you some steroids, some other medications to help you either dry up your secretions, or the opposites. If you have a lot of secretions, they'll probably tell you to drink a lot of water, maybe give you an expectorant to help you cough all that stuff out so that you can breathe easier. So that comes under the classification of, yes, we still treat you, we don't forget about you, but these are not curative things that we're going to do anymore.
With the anti-anxiety medications, how can that help with somebody who gets very breathless?
Well, when you consider that that's not really what it's made for, it's those medications are more made for people who just get anxious about everything. And there's plenty of patients with lung disease that are anxious about everything. And then to be able to not be able to breathe on top of that, and shortness of breath makes it even worse. So it just kind of dulls it, if you will, but it's not fixing the mechanics or whatever the reason is you're short of breath. It's just helping you with the anxiety. And hopefully at this point, you've been through pulmonary rehab, either online or in person, or you've been through some respiratory coaching to help you with some tools to keep you from spiraling. As soon as you feel that initial tightness in your chest and you feel like, here it comes, right? Then you would have some tools, whether it's music or meditation that you immediately put on, or your pursed lip diaphragmatic breathing, whatever exercises work for you, that you would do that. But sometimes as the disease progresses, you may need a little more help with that, just so you don't start spiraling when you feel that tightness in your chest.
Absolutely. It's easier to talk about doing those breathing techniques and remembering to practice those when you feel good, but when you have those moments where you do get really short of breath, you have that severe tightness, it's hard to remember, "Oh, practice this breathing technique and it'll make me feel better." That is something it takes a little bit of practice with.
That's why I love having apps on your phone, because or any kind of meditation apps, or any apps. You may have special ones that will just take you right to something. You can just plug your earbuds in and breathe along, and it's right there for you. And I'm hoping that BluZone will get their app and get that ready soon, so that people can do exactly that. You start feeling that little itch in your chest or whatever, hit the app, go ahead and just listen and breathe along, and just keep it from getting out of control. Keep yourself calm, and take your medications, do whatever else you need to do, check your saturations, but you're doing it in a very calm, methodical manner. You're not freaking out.
Hi, I'm Kelly, a registered respiratory therapist with BluZone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.
That's such a good idea with the apps. I think that that's a way to use technology that we don't really think about, but I think that that would be very helpful for people who are experiencing shortness of breath. So next, I really want to transition over into the family and the caregiver support that goes along with hospice care. So can you talk about that briefly?
I can. So if you've got family that still at this point in your life don't really understand what it is that you have and what it is that you're going through and what it is that you need, I would really recommend talking with a respiratory coach, and helping you list out the things that you really feel like you wish your family understood, and then get some tools just to talk to them and say, look, this is what I'm feeling, this is what I'm experiencing, and this is what I need from you. And if they can help you, let me say this: family and your friends, your neighbors, your extended family, whoever they are, would love to help you if only they knew how. And if you don't ask for it, or you don't know how to tell them what it is you need, then no one's going to help you. And so that's another reason to get with a coach, to say, okay, could you use some help with this? Could you use some help with that? Anything, grocery shopping, housework, putting the groceries away, walking the dog, anything, just list it out. And I think that you will find, and I've always said this, you will find that people are more than willing to help you out with something. And so some people think, oh, I don't want to ask, my kids to move home, or I don't want to move in with my kids. You're not even at that point yet. Have some people, your neighbors, family, immediate friends, just help you with one little thing. And if you've got 10 friends helping you with one little thing in a week, you've got it made, right? You've got everything done. But talking with a coach will help you figure out what are those things that really you'd like some help with. And what are some things, some ways that you can explain to your families and friends and say, this is what's going on with me. And whether they believe it or not, like it or not, this is what's going on. And I really need your understanding. And it could be something silly. You're in the picture, buddy. You want to say hi? Hey. It could be something silly, such as, I would love to come to Thanksgiving dinner or Christmas dinner or whatever, but I can't be around perfume. I cannot anymore. It used to just bother me. Now it just triggers an attack. That's the bottom
Right.
line. So this is how you can help me. No perfume. and when you start going on these ideas and figuring out what bothers your breathing, that will help too. I love you guys dearly. I know your dog is part of your family, but that dog cannot come to my house. As soon as the dog is there, my breathing gets tight. And I've been hiding it all this time because I want you guys to come visit. But the truth is, I can't hide it anymore. So that's one way you can get some support from people, is just really being honest with everybody about what you're feeling and going through.
And when would you normally say it would be time to call a hospice team member um, when you may feel like you need some adjustments?
When it really gets to be too much for you to manage. And some people live out in a rural area. Their closest neighbors are 2 miles away, and the only person they've got to help them is their spouse, who's also in their 60s or 70s or maybe 80s. And when it becomes too much, and you'll know when that point is, when it becomes too much, when your whole life is doctor's appointments because you've got so many things going on, that's the point where you say, you know what, we need to just kind of simplify this a little bit. When you reach that point, it's time to talk to somebody about hospice or even palliative care, either one. So talk to your team, your healthcare team, and they'll help you figure out what's the best option for you. If you live in the city, close to your doctor, no problem. You've got neighbors, kids, friends that'll drive you to appointments and things like that. Even still, there may come a point where you say, you know what, I'm over it. I'm just over it. And I really want to simplify things down. And that's the time.
And I would just encourage everybody to not be afraid to ask for help. These programs are here for a reason, and they're here to help you when you get to that point. So don't ever be afraid to ask for help, or just ask around and find what the best option is for you.
And, I just want to tie into that too. We talk about emotional health and mental health support for patients and families. And a really, really common thing with COPD patients and other lung patients as well is depression. They get very depressed because they realize, what are my options? They're really limited. But go talk to somebody about your depression. But what I've found over the years, and I've been doing this a long time, is once you go back a couple steps, like we said, and start enlisting your family, friends, neighbors, church-going friends, whoever, and start getting help, and people start realizing, I never knew you needed this help. Why didn't you call me like 6 months ago? I would have been there to help you. When people start realizing how much support and friendship and caring they really have, the depression goes away. And so go talk to a doctor and go see a professional if you want, but try that first step first when you realize how many people you have in your life that really care about you and are willing to help and will take the time. And you're not a burden and you're not a bother. All that suddenly will go away. You'll feel much better.
And I think it's also important when we talk about mental health and emotional health to also talk about the caregiver and the family of those who may be going into hospice care. Mental health is really important. And even for those individuals, it is a really hard thing to go through, even if it's not you yourself. If it's a loved one or a family member or somebody that you take care of, that can be really hard as well. So definitely take care of your mental health as a caregiver, family member, or friend.
Most definitely. I mean, watching people struggle to breathe, it's really hard to watch, and it's really hard to live with, and it's really hard to take care of these people day in and day out sometimes. So definitely take care of yourself, give yourself a break. And as the caregiver, you too enlist the help of some friends to give you a break so that you can go out and just spend an hour taking a walk to just clear your head, something so that you can get some time to yourself, because it can be overwhelming really quickly.
Looking at the last things. Do we have a whole lot more that we want to talk about other than closing thoughts?
No, we kind of talked about medication use, open conversations. I do want to talk about end of life though for a minute.
Okay.
Okay, so one other thing I think it's really, really important to take care of, and people put it off because they don't want to do it, and I really don't blame anybody for not wanting to do it, but getting your advance directive together, planning for end of life. No one wants to plan for end of life. Not me, not you, not anybody. But getting that advance directive together, and if you just Google advance directives and then your state, there should come up a form that you can fill out. All an advance directive really says is, here's what you can do to me and here's what you can't do to me. So if somebody, I see this all the time where somebody is on hospice care and they start getting a little bit worse and a lot more short of breath, and they can't even communicate, they're so short of breath. And even though it clearly says in their advance directive, do not call 911, call my kids instead. What does the caregiver do? Calls 911, they end up in the emergency room. So you want to have it laid out in your advance directive. If this happens, you can do this. If I end up in the emergency room, you can put me on high flow oxygen. No, you may not intubate me. Okay. If something happens to me and I completely crash, no, you may not do CPR on me. If something, an advance directive will walk you through that. And a health coach, a respiratory health coach will help you walk through that to say, you can do this to me, but you can't do that to me. If I end up having a problem with my kidneys, do you want dialysis? Do you not want dialysis? You get to decide how much you want done. And it's so important to have that done before the last minute. And also that way everybody knows, and hopefully everybody's on the same page with you, including your spouse and your children, as far as what you would like done and what you would not like to have done. Very, very important. And I put a link on the little worksheet over there, a really great comparison sheet about hospice and palliative care. And you can just Google advanced directives and it'll tell you everything, but just very important that you have that done.
Who all should have a copy of the advanced directive sheets as well?
That is a wonderful question. I would make 20 copies. Yes, 20. And please, when you make your 20 copies, if you update anything, remember that you have to go back to those same 20 people and give them the updated version. But 20 copies. So one is for you to keep it with you at all times. One is for your spouse, if you have one for each of your kids. One goes to your doctor. One goes to your oxygen provider. One goes to your best friend. One goes to your neighbors. Okay, people who might find you in distress, people who might see you out front, like you can't talk, you're just waving your hand. And instead of them calling 911, they'll go, wait, I got instructions. I know what to do. Hold on. So I always say make 20 copies and just give one to everybody that you can think of and say, this is what I want done. This is what I do not want done. So that way all your kids are on the same page, your spouse, your neighbors, your friends, your doctors, even your PA, your NP, anybody on your care team.
Well, thank you so much for speaking on hospice care and palliative care. It's so important to know about these things, even though they're probably not the most fun conversations to have. But it's really important to know about the oxygen and the medications that you may be on during hospice care, and to know what the point of hospice care is. So thank you so much for speaking on this. I think it was a really important topic to cover.
And I hope everyone will really listen to this and take it to heart. So thanks for joining us, and we'll see you next time.
See you next time.
Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy.